Welcome to the ATS Breathe Easy, the latest podcast. Here's your host, Patti Tripathi.
Hello and welcome. We have an extraordinary guest today who will discuss idiopathic pulmonary fibrosis and her presentation at ATS 2025 International Conference. Dr. MaryLuz Fuentes is not only a physician, but she's also a double lung transplant survivor. More from her in a bit. But first, here are some of the latest headlines. The measles outbreak continues. Experts warn that if you can't remember if you're vaccinated, see your doctor and get the shot. And for more information on the outbreak, check out our February 24th Breathe Easy podcast with Dr. Paul Offit and see the new patient fact sheet on measles at thoracic.org. Good news for those who rely on telemedicine. The pandemic-related telehealth flexibilities have been extended for several public health, Medicare, and Medicaid authorities and programs. And the social media influencers are at it again. Sleep maxing is the latest wellness trend. And it's about getting the maximum benefit from sleep. These days, a good night's sleep, about 7 to 9 hours. And that might seem as elusive. Social media isn't the answer for sleep tips based in science. Check out our show notes for links to the ATS patient sleep resources, including questionnaires. We'll be right back.
The ATS 2025 International Conference returns to San Francisco, May 16th to the 21st. Members get a discount on conference registration, so become an ATS member or renew your membership to take advantage of these savings. At ATS 2025, you can network with colleagues, find your next research collaborator, listen to patient stories and get inspired, and be among the first to learn about breaking news in pulmonary medicine. Register now to attend. Go to conference.thoracic.org today.
And welcome back, Dr. MaryLuz Fuentes. It's very nice to have you here. You look wonderful, by the way, and you were diagnosed with idiopathic pulmonary fibrosis in your 40s, which is very young. What is the difference between pulmonary fibrosis and idiopathic pulmonary fibrosis?
Well, thank you, Patti, for having me here. I'm excited to be here. And the pulmonary fibrosis is a broad term. The idiopathic pulmonary fibrosis is the most common of the diseases, the lung diseases of the interstitial lung disease. There are about 123 plus diseases that are under this big umbrella. And idiopathic pulmonary fibrosis is one of them, the most common. Yes.
What kind of symptoms were you having when you thought that you might have idiopathic pulmonary fibrosis? Were there some symptoms or were you misdiagnosed? You're a physician. Did you know what was going on?
Well, I was 47. I was a totally otherwise healthy young female, fully working in my late 40s. And then I started having an insidious dry cough that didn't seem to go away. Never in my wildest dream I thought that I was going to have this kind of a serious disease that I was diagnosed later on. The common symptoms of, not so common because actually they overlap with another pulmonary diseases. The symptoms for pulmonary fibrosis or idiopathic pulmonary fibrosis are cough. It's a dry cough, fatigue, shortness of breath, weight loss. And as you can see, those symptoms can be found in other lung diseases. For instance, as a physician, when I had the cough, which was the symptom that I presented, that was a dry cough, I thought in my mind that I had developed exercise-induced asthma. I was convinced that that's what it was. You know, my patients used to tell me, patients that follow me every 3 months and have seen me told me, Doc, you need a dog. And my husband was the one that insisted that I see someone. So I went ahead and saw an allergist because I was convinced that that's what I had developed. In fact, I used to bike with a friend of mine, and I used to sneak some bronchodilators out of the closet, the medicine closet in my practice, and pre-medicate myself before the bike rides because I was convinced that that's what I had. But it didn't help. So after 3 months, I went to see an allergist who gave me a spirometry and told me that I did not have exercise-induced asthma, that I had chronic bronchitis, and he gave me 30 days of antibiotic at that time. As you can see, I mean, I continue having the cough and the shortness of breath, and by late winter or early winter the following year, I was having very much short of breath. And I at that time, we had a 10-year-old daughter and a two-story house, and I went to the second floor to tuck her into bed, and I have to sit on her bed because I was panting. I was very short of breath. So I thought at that time that I had either something wrong was with my heart, or I was totally deconditioned, unconditioned. I was totally out of shape. So I went, and in my case, I mean, of course, I was familiar with the medical field. So I went and I scheduled an appointment, a visit with a cardiologist who put me with the battery of all these tests and told me that my heart was strong, and that I must see a pulmonologist. And that's how like 7 months later, I went to see, and the whole, since the symptoms presented, I went to see a pulmonologist who was the first one who actually did a pulmonary function test and did a chest x-ray and told me that there were some infiltrates, and he was, looking that something else more serious was going on.
Biopsy done? Did you have a biopsy done?
Yeah, as a matter of fact, since I was so young, I was 47, and in those days, when he gave me the pulmonary function test and a whole battery, I got a bronchoscopy and a lot of tests to rule in and rule out infectious diseases, connective tissue disorders, and then nothing was conclusive. And they thought at that time that along the way, I would develop a connective tissue disorder. But to these days, nothing had shown. So my diagnosis still was idiopathic pulmonary fibrosis. I underwent an open lung biopsy because it was inconclusive. I mean, they couldn't put me anywhere. And the pathology was read as a UIP, which is the pathology for idiopathic pulmonary fibrosis. And yes.
My mother too, around 2001, and she was 51. And that's what was her diagnosis. And she went through a biopsy, but she was also, people didn't know what she had. So at what point you were functioning well, fairly well, and were you taking oxygen, prednisone?
Well, those days, and now we're talking about 2007, 2008, there were not any therapies for idiopathic pulmonary fibrosis. I was not put on prednisone. I took a drug called Imuran on those days. We didn't have anything else. My disease progressed very slowly. It took about 10 years, not until 2017, that I started feeling more short of breath and becoming more desaturated, and I needed oxygen. So I was started on a portable oxygen concentrator, and I use it, and it was mostly with exertion. So every time that I did some activity, I desaturated, became more short of breath. And a few years passed back, and I continued to buy and I continued to work. It was far from me, but I accommodated. I used to take the 3 flight of stairs to go to my office, and I couldn't anymore. So I took the elevator. I hate it because I so about it patients in and so, but I
Were you in a denial at all? Were you in a denial?
Not in a denial, but my pulmonologist always mentioned lung transplant. So, and those LT words was so, I feared those too a lot. It was just so I knew what I had, and but I continued to cough, and it was before the stigma of the COVID. And I remember that I endure, people talking about my cough and commenting. I was just, everywhere I were, people diagnosed me. You have COPD, you got this, you got that, yeah. And then I remember even a patient going to HR and anonymously saying, how dare Dr. Fuentes coughing and seeing patients. I wish she, to this day, that I knew who she was or something, so would have told you, hey, what I have is not contagious. I have this, rather, I wish I have something contagious that perhaps could be treated with antibiotics, but I have something more serious in it. No, and here I was with the chronic, incurable disease, still taking care of my patients and doing my job. Yeah.
So something happened during COVID that required you to get not one, but double lung transplant. Well, did
What
you go on a waiting list all this time?
what happened is, no, I was still functioning with my portable oxygen concentrator with my 4 liters of oxygen. And then what happened, I contracted COVID before the vaccines were available. So even though I did not die, later on, within a month, I noticed that my stamina, my shortness of breath, it was getting harder for me to go on with my daily activities. Coming from my bedroom to my kitchen was just a task. Doing my bed, I couldn't do it. I was totally short of breath. So I went back to my pulmonologist and I told him what had happened, the one who had treated me during COVID. And he did my pulmonary function test and a 6-minute walk, and realized that FVC, which is the forced vital capacity, had declined more than 15%, and my oxygen diffusion, the DLC, has also plummeted. So he immediately changed my portable oxygen concentrator to a liters of tank of oxygens and sent it to my home, and also upgraded my concentrator that I had at home that went from 5 liters to 10 liters, and I immediately sent me for a lung transplant evaluation at an excellent center.
How long did you have to?
Yes, and they did all the battery of exams. It took about a week, and I was a perfect candidate. And then I was later on, after everything is done and you get all the list and all the exams and everything that you need, you were put into a list, and I was put on a list in a waiting list, and it took about 10 weeks until I was called. I had the call with that set of loans waiting for me.
Very short waiting list, because some people wait several years.
I know. Yes, I'm very fortunate.
And so tell me what happened after that.
Well,
the quality of life.
Yeah.
How did you, function after that?
Yeah, I had worked that day and I had finished my shift, and my husband told me that let's go out for dinner. So we went out to dinner, and then the phone rang, and I didn't answer because it was not a disclosed number. It was a private number, so I disregarded. And then they called my husband, and then he finally got it on, and then we were so nervous, and then so we came home, and I remember that I took a shower. I had already packed because they tell you to get packed. And then we called my daughter and my sisters and the rest of the family. And we actually, we have 4 hours to get to the center, because it was about 4 hours, 6 hours we had. It was about 4 hours by car. So my husband and my daughter were in the front of the car, and I was in the back finishing, the charts and the things that I have done today, and sending my information about to the organization that I worked, to tell them that I was going to. So it was the procedure is a monumental procedure, like I always said. And it's not like you get the transplant and everything finishing there. No, this is a compromise for life. My quality of life have changed. I can do my normal life without oxygen. However, I have challenges. Patients do have challenges of the anti-rejection medication that take a toll, and you are in a stage of immunosuppression, more prone to infections, to And of course, you take prednisone for the rest of your life. That put you at risk to develop diabetes as well. Some other the anti-rejection medication make you prone to cancers, to renal failure. So, but I am very grateful. I feel that I am very grateful to had had this procedure, and it was not, I didn't have any other options. So patients do not have any other options today. There are not any treatments. There are treatments that slow the progression of the disease, but nothing that cure the disease.
You look fantastic.
Thank
With
you.
my mom, there was only prednisone, and they had her on such a high dose of prednisone that that she fell and broke her hip, and in the hospital she acquired pneumonia and staph infection and died at the age of 56. But she only was on like 2 liters of oxygen. She was very active, and then 3 weeks later she's dead. It happened that fast. And it was so what they say, 2 to 6 years you generally live. It's sort of like being choked to death. It's such a devastating, horrible way to die, right? Because your lung capacity is changing.
Yes.
And my mother didn't have any support groups, and I hear that you started a support group for people.
Yes, 2 years after my diagnosis, I was on the, I had this aha moment that I said, I am a physician, but I am also a patient, and I need to find out if there are other patients who had this condition. So I remember pairing with my pulmonologist, and then talking about creating and funding a support group in the city that I used to live in. And I also ran an article in the local newspaper back in those days, and then also wrote an article in a publication that the hospital had that reached about 40,000 people. So with that, I was trying to raise awareness. So when the first support group, I had 3 people, and some of them came, and my husband had this, and somebody had this, and then they found that they saw somebody that also like them, had something in common. So the group grew, and I was very satisfied until I left the city where I used to live, and I'm proud to say that the group still is running by another patient, and will continue to raise awareness and educating patients and caregivers.
You're helping a lot of people. So do they know what the cause is? Some people say hereditary, others say it's chemicals. Used to be that they called it an old white man disease. And is it common amongst Latin or Hispanic community? I know that we are South Asian, and my mother was young, and you were young when you were diagnosed, and they still don't know what causes it, correct?
Well, the idiopathic pulmonary fibrosis is an unknown cause. There are some contributing factors such as smoking, age. The men are more prone to develop the pulmonary fibrosis than women. Women are more likely to develop pulmonary fibrosis secondary to a connective tissue disorder. There's also familial pulmonary fibrosis that runs within families as well. Yes.
So you also help the Hispanic community.
I do. I'm bilingual, if you can guess, for my Hispanic accent. There is an organization called PF Warriors, who was founded by a patient. The motto is helping patients. And at that time, also, we talked about that it was a great need among the Spanish-speaking patients in Central America and South America and Spain, where to make sure that we talk about the myth and the misconception and the education in their native tongue. So I decided, along with Nancy Suarez Lee, we both run, which is called the Guerreros de la Fibrosis Pulmonar, which is a geared to Spanish-speaking countries, and we meet every the fourth Tuesday every month, and we bring speakers that educate the patients and the caregivers. So it's we're very proud that we're doing very well and hoping and helping people in these countries.
You mentioned that there hasn't been a whole lot of progress. When my mother was diagnosed, prednisone was the only thing. That was around 2001, and you were diagnosed about 5 or 6 years later. Given the current situation right now, are you afraid that that research funding is going to be cut?
I am afraid, and I think it's very important, but I'm hopeful that that we will continue pushing and lobbying for the importance of getting more research. There has been a treatment. There has not been an approved FDA-approved treatment within the past. It's been a decade. There have been have drugs in phase clinical trial phase 3, which is which are very excited about. And a lot of research going on right now. So yes, it's very important that we focus on that research and continue to lobby for, because there is a lot of unmet needs among the community of pulmonary fibrosis.
Yeah, it's very important for clinicians and researchers to hear your story. What are you going to be telling people at the conference in May in San Francisco, the 2025 ATS conference?
Well, what I will be telling clinicians and patients at the ATS conference is that I had the opportunity to be in the physicians and the care provider bench, as well as in the patient's bench. And so I feel what as a patient is to have this chronic, progressive, debilitated, incurable disease. So we need to have a representation, a voice of patients to continue pushing for some more studies would not only focus on the forced vital capacity, but also in the quality of their life and their feelings that patients and caregiver do have.
Is there a stigma against IPF? Do people think that that people brought it upon themselves or something? They don't know anything about the disease?
I think there is still stigma, and mostly because of the symptoms that they don't know what people are patients that are unfamiliar. They think it's a contagious disease. It's not a contagious disease, and the cough make it almost like you have cooties. You
mentioned somebody, your patients thought that you had COVID and you were coughing on them.
Exactly. It's and I remember, even that was before COVID, and after COVID, I remember one time sitting on a restaurant when they opened up, and there was a man about 3 feet in front of us, whispering under himself, but I could hear, "Why did you stay here? Why didn't you stay home? Why did you come over here?" Blah, blah. Things like that, So it is sad, but yeah. But hopefully, we continue to work hard within the clinicians, the researchers, the patients, the caregivers, the media, just to be to raise more awareness, to educate more people.
Well, I look forward to your talk. I will be there as well. And thank you so much for joining me on Breathe Easy, the latest, and hope to see you in May.
Thank you, Patti. Appreciate that. Thank you very much for having me here.
Thank you for joining us today. To learn more, visit our website at thoracic.org. Find more ATS Breathe Easy podcasts on Transistor, YouTube, Apple Podcasts, and Spotify. Don't forget to like, comment, and subscribe so you never miss a show.